Hello, my name is Elizabeth Mann. I work at Fairfield Medical Associates, and the Office of Rural Health has asked me to share my expertise on safety and security for this training video. All of our petty cash is secured via logs. Everyone has to open their cash drawer in the morning with a certain amount of money. It's signed off and counted by the individual person and by a second person, and a log is initialed by both. It is also at the end of the day balanced out and signed off twice by two people. The cash is then secured in a locked closet for deposit the next morning. Complicated patients we handle, we have a very good receptionist who, there again, Winnsboro being a small town, we know most people in most situations, but if something feels like it's escalating or getting out of control, she has the ability to wave a pink index card kind of to signal to everyone else around that she thinks things are getting out of control, that someone should call for backup. We also have lots of an open area so that anybody can step in and help out, maybe even call one of our male doctors or male nurses to come to her aid. When someone comes to the front window asking about drugs, we of course tell them that they have to see a doctor, make an appointment. We don't give controlled substances without them being seen. All controlled substances, if they are seen, have to be picked up in person. A picture ID is shown to pick up your prescription, or if someone has to pick it up for you, then you have to let us know ahead of time who's picking up that prescription so we know who it's going to. Aggressive patients, we usually don't have a huge problem with that around here, but when they do get aggressive or we feel things are getting out of control, we then, of course, bring them out of the lobby into a secure, isolated area, try to talk to the patient, calm them down. If we need to, there again, someone can call for backup for 911 for police, or have our male doctors or one of our male nurses step in to help us out. Female staff, our office is set up as a pretty open area. The walls are kind of thin, so female staff is able to either leave a door open if they don't feel comfortable. They could tap on a wall. All of our rooms have computers that they're sitting at doing their notes, so that if they really feel something becomes aggressive or out of control, they could always send a note or a message in the computer, SOS, 911 message in the computer for someone to step in, and give them help. Emotionally unstable patients, there again, we don't have a lot of those here. We just try to bring them into a secure area, calm them down. Usually that works. We very rarely have to call for any kind of backup, and the doctors usually step in as we need them to, because most patients will respond very well to their doctor, to their primary care physician. Identity theft, our system has the availability to scan in their insurance card and a picture ID, and we also have a webcam that we can take pictures for the individuals, like students or people who may not have a driver's license, and that's how we check and balance those things.